Regenerative therapy can be the missing step between the conservative management and surgery. When you have chronic knee pain, back pain, shoulder pain, tendon injuries, or joint pain, treatment usually starts with medicines, rest, exercise, and physiotherapy. And for many patients, these treatments work very well. But what happens when pain keeps coming back? You have taken medicines, you have completed physiotherapy, you have modified your activities also. Yet the pain is still affecting your walking, exercise, work, or daily life. And then someone tells you, now surgery is the only option for you. But is there something we can consider between this conservative management and surgery? Yes, in selected patients, the answer may be regenerative medicine. Regenerative therapies can help bridge the gap between conventional conservative treatment and surgery. Instead of simply suppressing pain, the goal is to create a biological environment that may support the body's natural healing and repair processes. Depending on the condition, we may consider treatments such as PRP, that is platelet rich plasma, bone marrow concentrate, or simple treatment like prolotherapy. PRP is prepared from your own blood. These platelets are concentrated and delivered to the injured or painful area where their growth factors and signaling proteins may support the healing response. Bone marrow concentrate is another option used in selected musculoskeletal conditions. It contains a mixture of cells, platelets, and biological signaling molecules obtained from patient's own bone marrow. Even prolotherapy, a simple technique, a comparatively simple injection based treatment, may have a role in selected ligament, tendon, and joint related conditions. Now, does this mean everyone should take PRP and bone marrow treatment instead of surgery? No, absolutely not. Some injuries and advanced structural problems genuinely require surgery. Regenerative medicine should not be marketed as a miracle cure or as a replacement for every operation. The important thing is patient selection. For example, in selected cases of osteoarthritis, tendon injuries, ligament problems, and other chronic musculoskeletal pain conditions, regenerative therapies may be considered after appropriate clinical examination and imaging, and timing matters most. Many patients wait until their condition has become extremely advanced and only then start looking for non surgical alternatives. A better approach is to explore your options early. If medicines, physiotherapy are no longer giving adequate relief, but you are not yet ready for surgery, ask whether regenerative treatment could be appropriate for your condition. The objective is not simply to postpone surgery, the objective is to improve pain, function, quality of life while supporting recovery wherever biologically possible. So, before jumping directly from physiotherapy to surgery, find out whether there is another step available for you: PRP, bone marrow concentrate, or prolotherapy. Not every treatment is suitable for every patient, but the right treatment in the right patient may make meaningful difference. Consult a qualified regenerative pain medicine specialist. Understand your diagnosis, discuss the evidence and realistic expectations, and then make an informed decision. Because when it comes to chronic pain, surgery isn't always the next step.